There are truths in healthcare that slip through the cracks, hidden beneath layers of trust, busy clinics, and mountains of prescriptions every year. You trust your doctor to have your best interests at heart, but sometimes even they do not realize the risks hiding in plain sight. Dementia is one of the most feared diagnoses, a slow erosion of memory, reasoning, and even the sense of self, yet often misunderstood. Few people know that certain everyday medications, prescribed casually, could be silently accelerating the very brain decline they desperately hope to avoid. This isn't a fear tactic. It's a truth too important to ignore, especially when some pills in your cabinet may be culprits. Doctors are bound by guidelines, and while they mean well, not every risk is fully explained, especially in the blur of appointments. Today, we will pull back the curtain and reveal 9 medications that research links to faster cognitive decline, memory loss, and dementia. Each of these drugs is commonly prescribed, casually recommended, and rarely flagged for the devastating impact they may have on your brain. The purpose is not to frighten, but to empower you, because once you know, you can make choices that protect your mind. If you or a loved one are taking any of these medications, it may be time to ask questions and seek alternatives. Let's begin with one of the most underestimated dangers lurking in the medicine cabinet, a group of drugs called anticholinergics. Anticholinergics are found in medications treating everything from allergies to bladder problems, yet their effect on the brain can be catastrophic over time. They work by blocking a neurotransmitter called acetylcholine, which plays a critical role in memory, learning, and overall brain communication efficiency. When you block acetylcholine, you are effectively pulling the brakes on one of the brain's most important systems for mental clarity and function. A major study from the University of Washington showed a clear link between long-term anticholinergic use and an increased risk of dementia. Shockingly, the risk remained elevated even after the drugs were stopped, suggesting permanent changes to brain structure and cognitive capacity over time. Some common anticholinergic medications include older antihistamines like diphenhydramine, Benadryl, bladder medications like oxybutynin, and certain antidepressants like amitriptyline. Even over-the-counter sleep aids often contain strong anticholinergic ingredients, meaning millions could be unknowingly increasing their dementia risk nightly. The tragedy is that anticholinergic medications are often prescribed casually with little long-term warning, especially for older adults more vulnerable to brain changes. Patients may start these drugs for mild problems like seasonal allergies or urinary urgency without realizing the long-term costs to mental sharpness. Next, let's talk about a drug class that's even more pervasive: benzodiazepines, prescribed for anxiety, insomnia, and even panic disorders. Drugs like diazepam, Valium, lorazepam, Ativan, and alprazolam, Xanax, are household names, but their impact on cognitive function is deeply alarming. Benzodiazepines work by enhancing the effect of GABA, a neurotransmitter that calms the nervous system, slowing brain activity to induce relaxation. While short-term use can be life-saving during severe anxiety episodes, long-term benzodiazepine use can spell disaster for memory and cognition. Studies show a dose-dependent relationship between benzodiazepine use and dementia risk. The higher the dose, the greater the cognitive impairment observed. In fact, one 2014 study in the British Medical Journal found that taking benzodiazepines for more than 3 months increased dementia risk by 51%. These drugs can also cause confusion, drowsiness, and impaired balance, leading to falls, fractures, and further health decline among older adults. The irony is that people who begin benzodiazepines for anxiety or sleep often find themselves trapped, unable to function without them over time. Sadly, their brains are being quietly reprogrammed, slowing thought processes, degrading memory pathways, and opening the door to faster dementia onset. Benzodiazepines are still prescribed with alarming frequency, despite overwhelming evidence suggesting they are hazardous for long-term brain health. Another unsuspecting culprit is antipsychotic medications, which are sometimes used off-label to manage agitation, depression, or behavioral symptoms in elderly patients. Medications like risperidone, olanzapine, and quetiapine were designed for serious psychiatric illnesses but have crept into general elderly care settings alarmingly. Antipsychotics dampen brain activity by altering dopamine and serotonin pathways, effectively flattening emotional and behavioral responses, but at a heavy cost. Numerous studies confirm that antipsychotic use in seniors is associated with faster cognitive decline, higher stroke risk, and even premature death. In dementia patients, antipsychotics are supposed to be a last resort, yet they are often prescribed simply to quiet, difficult behaviors. The brain under antipsychotic influence becomes sluggish, less capable of forming new memories, and progressively deteriorates with prolonged use. This creates a vicious cycle where a drug intended to manage symptoms ironically worsens the very disease it was meant to control. One of the most sobering findings is that even low doses of antipsychotics can dramatically worsen dementia progression over just a few months. Family members often notice that their loved ones become zombies after starting these drugs, losing personality, memory, and independence at rapid speeds. Once started, it can be extremely difficult to reverse the cognitive damage or safely taper off these medications without serious withdrawal symptoms. The next class to scrutinize is antihistamines, specifically the first-generation types that readily cross the blood-brain barrier. Diphenhydramine, Benadryl, and chlorpheniramine are classic examples, sedating antihistamines that not only make you sleepy but subtly erode mental sharpness. As mentioned earlier, many antihistamines possess anticholinergic properties, directly interfering with acetylcholine and hence memory formation and recall abilities. Because these drugs are available over the counter, people mistakenly assume they are harmless and use them frequently for allergies or sleep. Over time, regular use of sedating antihistamines has been linked to measurable decreases in brain volume and cognitive test scores. Even occasional use in vulnerable populations like seniors can significantly impair executive functioning, making tasks like planning, reasoning, and recalling difficult. Many people report feeling foggy, confused, or out of it the morning after taking sedating antihistamines, a warning of deeper neural effects. Researchers have warned for years that these medications are brain unfriendly, especially when safer, newer antihistamines are readily available as alternatives. Yet pharmacies continue to stock shelves with first-generation antihistamines prominently displayed, misleading consumers about their true neurological danger. Next, we turn to opioids, powerful painkillers like oxycodone, morphine, and fentanyl that also have disturbing associations with accelerated cognitive decline. Opioids work by binding to specific receptors in the brain and spinal cord, muting pain signals but also altering brain chemistry significantly. Chronic opioid use has been linked to structural brain changes, including reduced gray matter volume, which is essential for memory and reasoning. Long-term opioid users often experience significant memory lapses, impaired attention span, slowed reaction times, and overall reduced mental agility. A 2020 study in the Journal of Alzheimer's Disease confirmed that opioid users faced a higher risk of developing dementia than non-users. Moreover, opioids can worsen depression, suppress normal breathing patterns during sleep, and reduce oxygen flow to the brain, all disastrous for cognition. Doctors may prescribe opioids liberally after surgery or for chronic pain, but rarely warn patients about the long-term consequences for brain health. Pain relief must be balanced carefully against cognitive safety, especially when alternatives like physical therapy, acupuncture, and non-opioid medications exist. The tragic stories of older adults descending into cognitive fog after prolonged opioid use should serve as a powerful cautionary tale for us. Yet another hidden risk comes from statins, medications prescribed to lower cholesterol and reduce the risk of heart disease and stroke. While statins like atorvastatin and simvastatin can save lives, emerging evidence suggests they may also interfere with brain function for some individuals. The brain is composed largely of cholesterol, and disrupting cholesterol synthesis can impair synapse formation, neurotransmission, and memory processing. Some patients report severe memory loss, confusion, and brain fog shortly after starting statins, symptoms so profound that they mimic early dementia. Although many studies downplay these risks, others show a subset of patients, especially older adults, who experience alarming cognitive side effects from statins. The FDA even added a warning label in 2012 acknowledging that statins may cause memory loss, confusion, and other cognitive problems. Critically, not everyone on statins will suffer cognitive decline, but for those who do, the impact can be life-altering if not caught early. Doctors may dismiss these symptoms as normal aging, rather than suspecting the medication intended to protect the heart is harming the brain. At this point, it's crucial to stress no medication is universally bad, but individual risk factors make certain drugs much more dangerous. Your unique brain chemistry, age, genetic predispositions, and medication combinations all interact to determine how vulnerable you are to dementia acceleration. Thus, an honest conversation with your doctor about any troubling medications and safer alternatives is one of the wisest moves you can make. Up next, we'll explore 3 more common medication types, each with shockingly underreported connections to memory loss and dementia onset. We arrive at another surprising contributor to cognitive decline, proton pump inhibitors, commonly known as PPIs, used to treat heartburn. Popular PPIs include omeprazole, Prilosec, esomeprazole, Nexium, and lansoprazole. Preface: medications millions use daily for acid reflux or gastroesophageal reflux disease, GERD. While they bring immediate relief from heartburn, long-term PPI use has been associated with serious risks, including an elevated chance of developing dementia. PPIs reduce stomach acid production, but stomach acid is essential for absorbing vital nutrients like magnesium, calcium, and vitamin B12 into the bloodstream. Deficiencies in these nutrients, particularly vitamin B12, have direct and well-established links to memory loss, confusion, and accelerated neurological degeneration over time. One German study found that seniors regularly using PPIs had a 44% increased risk of dementia compared to those not using these drugs. The proposed mechanism suggests that impaired nutrient absorption and chronic inflammation combine to create an environment highly conducive to cognitive deterioration. Yet many people are placed on PPIs indefinitely, despite FDA guidelines recommending their use only for short periods, ideally no longer than 8 weeks. Patients may be prescribed PPIs casually after a single episode of heartburn and continue refilling prescriptions for years without reevaluation or caution. The cumulative impact of chronic PPI use on brain health is now becoming more apparent, but still, the information rarely reaches patients directly. As with all medications discussed, it's essential to weigh benefits against risks carefully and consider stepping down under medical supervision when appropriate. Next, we must shine a spotlight on corticosteroids, powerful anti-inflammatory drugs prescribed for a variety of conditions, from asthma to arthritis to lupus. Prednisone, methylprednisolone, and dexamethasone are examples of corticosteroids that, while life-saving in acute situations, carry troubling long-term consequences for brain function. Corticosteroids work by suppressing the immune system and reducing inflammation, but they also impact the hippocampus, the brain's critical center for memory processing. Studies show that chronic corticosteroid use can shrink the hippocampus, leading to memory impairment, emotional instability, and increased vulnerability to cognitive decline. Patients often describe feeling mentally slower, more forgetful, and emotionally volatile after extended courses of corticosteroids, signs of underlying neurological changes taking place. In fact, a condition called steroid psychosis can develop in some individuals, featuring severe memory loss, confusion, and even hallucinations with high-dose corticosteroids. Long-term corticosteroid therapy is known to disrupt normal neurotransmitter balances, impair neurogenesis, and contribute to irreversible brain aging at an accelerated pace. While sometimes unavoidable in treating serious conditions, corticosteroids should always be used cautiously and sparingly, with constant monitoring for cognitive side effects. Alternative therapies, lower dosing schedules, and aggressive weaning strategies should always be considered to minimize the devastating cognitive impacts of prolonged corticosteroid exposure. Unfortunately, patients are often prescribed corticosteroids without sufficient warning about their potential brain risks, another hidden threat in modern medicine's landscape. Now, we arrive at the final group of medications with profound implications for dementia risk. Antiepileptic drugs, AEDs, used to manage seizures and neuropathic pain. Medications like phenytoin, carbamazepine, and valproic acid are examples of AEDs that dampen excessive electrical activity in the brain to prevent seizures. However, they also suppress normal brain signaling and plasticity, processes crucial for maintaining memory, learning, and executive functioning across the lifespan. Long-term AED use has been associated with measurable declines in cognitive performance, memory impairments, and even structural changes visible on brain imaging scans. Some studies report that individuals on AEDs perform worse on cognitive tests than those with epilepsy who are not medicated, suggesting a direct effect. Moreover, newer uses of AEDs, such as treating chronic nerve pain or mood disorders, have expanded their reach beyond traditional epilepsy care. This means more people are exposed to AEDs without fully understanding their potential costs in terms of long-term mental clarity and brain health. Doctors prescribing AEDs for non-epileptic conditions often emphasize immediate symptom relief without thoroughly explaining the possible trade-offs to memory and cognitive resilience. Older adults, whose brains are naturally more vulnerable to structural and functional changes, face particularly heightened risks when placed on anti-epileptic regimens. It is essential for patients and caregivers to recognize early cognitive changes and discuss alternative strategies before irreversible damage sets in. Having uncovered these 9 major classes of medication, a chilling realization emerges. Some of the most trusted treatments may quietly rob us of ourselves. This truth demands vigilance, education, and courage, both from healthcare providers and from patients willing to ask the difficult but necessary questions. Brain health is precious, and defending it requires a proactive, informed approach rather than blind faith in every pill prescribed or recommended. Now, with a full understanding of the 9 categories, let's briefly revisit why medication risks often remain hidden from patients' immediate awareness. First, medical training prioritizes immediate symptom management. Solving the pressing problem often outweighs concerns about slow, long-term cognitive effects in clinical decision-making. Second, pharmaceutical marketing strategies minimize discussion of rare or delayed side effects, focusing instead on the fast, tangible benefits of their products. Third, time constraints in modern healthcare leave little room for lengthy discussions about nuanced risks during brief, high-pressure patient consultations. Fourth, many healthcare providers are themselves unaware of emerging studies linking certain drugs to dementia, given the overwhelming pace of medical literature growth. Fifth, patients often trust medications too much, believing if something is prescribed it must be safe, without questioning long-term brain consequences. Sixth, the gradual nature of cognitive decline means that patients, and even their doctors, may fail to connect symptoms to medication until it's too late. Seventh, fear of litigation can sometimes deter open conversations about rare but serious risks, as disclosing everything might seem unnecessarily alarming to patients. Eighth, withdrawal from certain medications, particularly benzodiazepines or corticosteroids, can be dangerous, requiring careful supervision, so doctors may hesitate to initiate that conversation. Ninth, and perhaps most importantly, the healthcare system often rewards short-term outcomes over long-term wellness, a systemic flaw that perpetuates these hidden dangers. Understanding these forces equips you with a sharper lens to navigate conversations about your prescriptions, empowering you to advocate for your cognitive future. As we close this section, it's crucial to remember, no medication automatically dooms you to dementia, but informed choices dramatically shift the odds. Your brain deserves the same protection and attention that you would give any vital organ, arguably even more so given its irreplaceable nature. By questioning prescriptions, seeking second opinions, and exploring non-pharmaceutical options, you can greatly reduce unnecessary risks to your mental clarity and longevity. We must move forward now into a broader conversation. How can you protect yourself practically if you're already taking one or more risky medications? What strategies exist to minimize damage, optimize brain recovery, and support cognitive health even if medication use is unavoidable for underlying conditions? We'll explore those answers next, as well as signs that your brain may already be struggling under a hidden pharmaceutical burden you didn't suspect. Now that you are aware of the 9 categories of medications associated with increased dementia risk, the next step is action. Understanding the problem is only half the battle. Implementing practical strategies to protect your brain is where true empowerment begins for you. First and foremost, start by conducting a thorough review of all your current medications, both prescription and over-the-counter, including supplements if possible. Create a written list, including dosages and frequency, and bring it to your next medical appointment for a detailed and honest discussion. Ask your doctor specifically, are any of these medications linked to memory loss or cognitive decline, especially for someone in my situation? Many doctors appreciate proactive patients and will be more inclined to reassess your treatment plan once you demonstrate thoughtful concern and awareness. If you are taking a high-risk medication, do not panic or abruptly stop taking it without professional guidance, which can be dangerous. Instead, ask whether safer alternatives exist. Sometimes newer drugs, lifestyle interventions, or combination therapies can provide similar benefits with fewer cognitive side effects. For example, newer second-generation antihistamines like loratadine have minimal brain penetration compared to older sedating versions like diphenhydramine, Benadryl. Similarly, cognitive behavioral therapy for insomnia, CBTI, has proven more effective than sleeping pills in the long run, with zero risk to memory. Patients prescribed benzodiazepines for anxiety can sometimes switch to non-addictive alternatives like buspirone or practice mindfulness-based stress reduction techniques effectively. Those on opioids may benefit from integrative pain management approaches, including physical therapy, acupuncture, massage, and non-opioid medications such as duloxetine. If corticosteroids are necessary for autoimmune conditions, inquire about the lowest effective dose, intermittent therapy schedules, or alternative immune-modulating treatments. When reviewing statin use, discuss your overall cardiovascular risk profile. Sometimes lifestyle changes alone can significantly lower cholesterol without impairing cognitive function. In cases where medication withdrawal is unsafe or impossible, focus on bolstering brain health through complementary strategies known to protect cognition. Diet plays a massive role here. Adopting a Mediterranean-style diet rich in leafy greens, berries, olive oil, and omega-3 fatty acids can help. Regular physical exercise, especially aerobic workouts like brisk walking or swimming, has been consistently shown to increase hippocampal volume and improve memory. Cognitive training programs, learning new skills, engaging in puzzles, and maintaining active social connections all stimulate neuroplasticity and preserve brain resilience. Quality sleep is another cornerstone of brain preservation. Prioritize healthy sleep hygiene practices to maximize nighttime brain cleansing processes and memory consolidation. Chronic sleep deprivation can compound cognitive decline, especially in individuals already vulnerable due to medication-induced neurotransmitter imbalances or brain aging processes. Stress management cannot be overlooked either. Chronic stress damages the hippocampus through cortisol surges, accelerating memory loss and impairing executive function significantly. Meditation, yoga, deep breathing, and spending time in nature are potent antidotes to the brain-warping effects of persistent psychological stressors. Additionally, protecting vascular health through blood pressure control, diabetes management, and smoking cessation indirectly supports brain vitality over the decades. Dementia is multifactorial. While medication risks are important, they interact with lifestyle, genetics, and environmental factors to determine your overall cognitive destiny. Thus, mitigating medication brain damage must be part of a broader, holistic, brain-protective lifestyle that leaves no stone unturned in safeguarding memory. Now, let's discuss specific warning signs that your brain might already be suffering from the hidden side effects of certain medications. Early recognition is crucial. Addressing subtle symptoms immediately can sometimes halt or even reverse cognitive decline before permanent damage is entrenched. One of the earliest red flags is increased forgetfulness, especially forgetting appointments, conversations, or where common objects were placed around the house. Mild disorientation, getting lost while driving familiar routes, or struggling to follow familiar recipes can also be an early warning signal worth investigating. Language difficulties, such as word-finding problems or substituting incorrect words in conversation, may hint at early medication-induced language network disruptions. Changes in mood, especially increased irritability, depression, or apathy, often accompany early cognitive changes and may reflect medication-stimulated neurotransmitter disturbances in the brain. Decreased problem-solving ability, poor judgment, or difficulty following multi-step tasks like balancing a checkbook are subtle but significant early cognitive warnings. Family members and close friends often notice these changes first, so it's important to listen carefully to external observations about your behavior. Physical symptoms such as increased drowsiness, imbalance, or tremors, especially after starting a new medication, may also indicate brain side effects developing. If you or someone you love notices 2 or more of these symptoms, it is vital to act promptly and seek evaluation. Cognitive screening tests, neurological examinations, and comprehensive medication reviews can pinpoint whether medications are contributing to emerging cognitive symptoms or decline. Remember, early intervention offers the best chance of recovery, especially if the cognitive impairment stems largely from modifiable pharmaceutical causes. Cognitive rehabilitation therapy, medication adjustment, and aggressive lifestyle optimization can sometimes restore significant cognitive function, even after early signs of decline appear. The worst mistake is assuming forgetfulness or confusion are just part of getting older, without investigating reversible causes like problematic medication use. The brain is remarkably resilient when given the right environment to heal, but the window of opportunity narrows with each passing month. By paying close attention to cognitive warning signs and taking them seriously, you give yourself or your loved ones the best fighting chance. So far, we have focused on protecting yourself individually, but there's also an urgent need for broader systemic change to address these issues. Public health initiatives, medical education reforms, and improved patient advocacy are essential to creating a healthcare system that truly protects brain health. Medical schools must place greater emphasis on teaching future doctors about long-term medication side effects, especially regarding brain aging and dementia risk. Continuing education for practicing physicians should highlight emerging research linking common medications to cognitive decline, equipping them with better prescribing habits and vigilance. Insurance companies and healthcare systems should incentivize deprescribing initiatives, cognitive monitoring programs, and lifestyle-based disease management to prioritize long-term brain wellness. Patients, too, must become fierce advocates for their own cognitive futures, demanding full disclosure of medication risks and pushing for safer alternatives. Family members should participate actively in medical consultations, helping vulnerable patients ask questions, understand options, and make informed medication decisions together. Ultimately, protecting your brain is a shared responsibility, one that requires informed individuals, enlightened practitioners, and systemic commitment to cognitive safety and longevity. Brain health advocacy groups can play a crucial role by raising awareness, funding research, and pressuring regulatory agencies to enhance warning labels and guidelines. We are entering an era where dementia rates are expected to skyrocket, and every preventable cause of cognitive decline must be urgently addressed. Medication-induced brain damage is one such preventable cause, an invisible epidemic hiding beneath well-meaning prescriptions and the normalization of cognitive side effects. Armed with knowledge, vigilance, and determination, you can be part of the movement to change how we think about medication and memory forever. Even one life spared from needless dementia represents a victory, and through collective effort, millions of minds could be protected and preserved. Let us now move into the final section, a hopeful, actionable plan for anyone who wishes to detox, rebuild, and revitalize their brain. This plan is designed to help you step confidently into a future where clarity, memory, and vibrant thinking remain your trusted companions. If you are ready to move from awareness to action, you will need a clear, focused plan to protect your brain. The first step is detoxification, strategically reducing or eliminating medications known to impair cognition under the careful guidance of a trusted physician. Detoxification does not mean stopping medications cold turkey. It involves gradual tapering, substitution, and careful monitoring for withdrawal effects or health destabilization risks. Schedule a medication review appointment specifically focused on cognitive preservation, emphasizing your desire to minimize brain-impacting drugs wherever possible and reasonable. Work collaboratively with your doctor to prioritize which medications are most dangerous and which alternatives or dosage reductions make sense for you. Some medications, like benzodiazepines or corticosteroids, require extremely slow tapers over weeks or months to avoid dangerous rebound effects or severe health complications. During this process, monitor yourself vigilantly for signs of cognitive improvement, mood stabilization, or return of clarity, early victories that reinforce your journey. Keep a journal to track mental clarity, energy levels, sleep quality, emotional resilience, and memory performance throughout the detoxification and medication optimization process. The second step is brain nourishment, feeding your brain the nutrients it desperately needs to rebuild damaged neural pathways and enhance cognitive resilience. Focus on nutrient-dense foods, wild-caught fatty fish for omega-3s, dark leafy greens for folate, colorful berries for antioxidants, and nuts for vitamin E. Consider high-quality supplements under medical supervision, including magnesium, phosphatidylserine, curcumin, and vitamin D, all linked to improved cognitive performance and neuroprotection. Stay hydrated, avoid excessive alcohol, and minimize consumption of processed sugars, trans fats, and artificial additives known to impair brain function. The third step is cognitive reactivation, stimulating dormant neural networks through deliberate mental challenges, creative endeavors, and continuous learning practices every single day. Pick up new hobbies that stretch your mind, learning a musical instrument, studying a new language, solving complex puzzles, or exploring philosophy. Participate in social groups, discussion clubs, or volunteer organizations. Social stimulation has powerful effects on preserving memory and executive functioning into old age. Rotate activities regularly to ensure diverse neural engagement. Routine is the enemy of neuroplasticity, while novelty breathes new life into your brain. The fourth step is emotional regulation, addressing unresolved emotional burdens, minimizing chronic stress, and cultivating a state of calm, balanced psychological well-being. Incorporate daily mindfulness meditation, journaling practices, gratitude rituals, and stress reduction exercises that help soothe your nervous system and protect your cognitive health. Seek therapy if you carry significant trauma, grief, or chronic anxiety. Healing emotional wounds reduces harmful cortisol exposure that accelerates hippocampal atrophy and memory loss. The fifth step is physical rejuvenation, optimizing your body's health to ensure your brain receives the oxygen, nutrients, and movement it desperately requires. Engage in at least 150 minutes of moderate aerobic exercise weekly, combining cardio sessions with strength training and flexibility-enhancing activities like yoga. Prioritize restorative sleep. Establish a consistent bedtime. Remove electronic distractions. Create a cool, dark sleeping environment. And develop a peaceful evening routine. Sleep allows your brain to clear out metabolic waste products, repair damaged neurons, and consolidate new learning into long-term memory pathways efficiently. Finally, regularly monitor and manage cardiovascular health markers, including blood pressure, blood sugar, cholesterol levels, and body weight, all directly linked to dementia risk. Every small positive change you make, every pill reviewed, every healthy meal eaten, every walk taken builds a more resilient, powerful mind over time. Healing and revitalization may feel slow initially, but cumulative progress often becomes profound, yielding sharper memory, improved focus, and increased emotional resilience. Visualize your brain growing stronger with each decision you make to prioritize its care. The mind responds powerfully to conscious, deliberate nurturing actions. This journey is not about fear. It is about empowerment, reclaiming control over your cognitive future and refusing passive decline as inevitable. You now possess knowledge that most people sadly never receive until it is too late and their memories are already slipping away. With this knowledge comes the profound responsibility and profound opportunity to change the trajectory of your own mind and the minds of those you love. Imagine living your later decades with vibrant mental clarity, sharp recall, and rich emotional presence, treasuring every precious moment with full awareness. Imagine staying intellectually engaged, continuing to learn, grow, and contribute meaningfully to the world long after many peers succumb to cognitive fog. That future is possible, but it requires vigilance against hidden enemies like the medications we have explored together in this important conversation. It requires unflinching honesty with yourself, courage to advocate for better care, and daily commitment to the habits that preserve and enhance cognition. You have already taken the most important step by learning the truth. Now the path forward is clear, steady, and deeply rewarding. As you move forward, remember, protecting your brain is an act of love, not just for yourself, but for everyone who loves you. Your memories, your personality, your stories, your wisdom, they are treasures beyond measure, and they deserve every effort to be fiercely safeguarded. You are not powerless against dementia. You are not destined for decline. You are a powerful force for your own mental longevity. Let every choice you make from today onward be a tribute to the miraculous brain that makes you who you are. Stay curious, stay courageous, stay committed. The mind is capable of extraordinary healing, and your future is brighter than you may yet imagine. Thank you for taking this journey toward truth, empowerment, and enduring mental vitality. You have honored yourself in a way few people ever do. Your brain, your memories, your very essence are worth fighting for, and now you are ready to fight wisely, bravely, and victoriously.